So thank you very much to everyone who joined today's session. So the agenda for the meeting today, we will do a quick overview of the Consumer Technology IEEE Society, and then we will follow it by the presentation by Derek Herrera, and we will close it by the Q&A. If we run over, it's not a problem. So this was just a suggested agenda. So the call to everyone who is on the call is please post pictures, tweet, do whatever needed. This is a couple of handles for the Twitter which you can use. The IEEE Silicon Valley chapter for consumer technology is yours truly is here. Beth is a co-chair. Avid is our vice chair. Pat Fasant and our secretary and treasurer. Joseph is a marketing chair. You met Joseph Way, and in our chapter he is a webmaster, and Michael Wong is a program chair. What we're looking for, as always, we're looking for volunteer speakers, anyone who can help us to promote the history and legacy of IEEE. The next meeting will be on April 14th on the RISC-V Foundation and what we are doing for the ecosystem with Ted Marina from Western Digital. I will skip the poll on the questions, how many of us are IEEE, but if you're interested in becoming an IEEE member, we have a 208 with some ranges plus minus $1 to $5 month annual fee, membership fee. Students are only $32 a year. You do get a discount. For Consumer Technology Society, it's additional $40. And we also have some promotions and benefits which you can check out. We have a recruitment program, and it still goes until August 2021. You can get $15 for each professional member recruitment, $5 for the electronic membership, and so on. As you all know, you will get publications, the IEEE magazines, and many more of the other awards. If you have any suggestions, topics, or etc., you can contact me with the email at all.myactionspot.com. If your company is looking for recruitment, and I know some of the companies do, please share the information and we will happily distribute it across the different IEEE societies. And I'm sure you will find a highly qualified and skilled labor force. Same goes if you're looking for a job, please reach out. And on that note, let me go to the highlight of today's. And allow me to introduce Derek Herrera. Derek is an entrepreneur, advisor, and board member for multiple startups and nonprofits. I met him at UCLA Anderson, and he is one of the most impressive people which I came across in my life. It's quite an inspiration. His life story, the books will be written about it. He currently serves as a founder and CTO for EuroDev Medical. It's formerly called Final Singularity. And he also funded EuroDev while he was at UCLA in 2015. And then he graduated the EMBA program. He also founded and launched Habit Camera, the first low-cost digital skin inspection tool for people with limited mobility, diabetes, and other skin conditions. The Habit Camera also supports the telehealth and enables patients to send images to caregivers and so on. The topic of the discussion today will be medical devices by EuroDev and IntelliFlow for people with disabilities. Derek will talk about the experience as an entrepreneur in the medical device industry. I'm sure it was quite a road. Specifically, he will discuss methods used to identify unmet needs in the industry and techniques to develop solutions to address these issues. Derek will discuss strategy development and foundation for EuroDev Medical and IntelliFlow blood management system. ELIFLOW is the first fully internal extended use bladder management system that enables adult males with urinary retention to empty their bladder using wireless remote controller. He will also talk about the habit camera and the first digital skin inspection tool for people with limited diabetes and other skin conditions. During today's session, I highly encourage everyone to post the questions in our Q&A. We will address them as we go, and I hope, Derek, you will ask questions, and what we're presenting today is quite an inspiration. On that note, allow me to give the floor to Derek Herrera, and let's start the session.
Awesome. Thank you so much for that kind introduction, Olga. Truly appreciate it, and appreciate your friendship over the past 5 years or 6 years since, actually, it's been, time flies. It's like 7 or 8 years since we first met. So,
yeah.
So pleasure to be here with you guys today. I have some quick slides that I'll run through with my screen, and then also show you some videos and open it up for questions and everything else. So, so I'd like to make this as interactive and beneficial for all of you as well. I've been very fortunate to have some diverse and interesting experiences over the past, 5 or 6, almost 6 years now as a medical device entrepreneur, leaving as I graduated UCLA, and excited to share. So in addition to that, I'll give you my personal email. You can feel free to email me anytime, and happy to connect outside of this if there's anything else that I can support your efforts with as well. So I'll start sharing my screen, and let's see here. All right, screen 2 coming in hot. Okay, so you guys can see this? Yep, awesome.
Yeah, we can.
Perfect. Okay, so as Olga mentioned, my name is Derek Herrera, a medical device entrepreneur, and after I got injured in the military, went through a challenging time to find my new mission, my new purpose in life. And what I found over some soul searching was that my mission, my new purpose, was to try to improve life through innovation, and specifically in the medical device industry, trying to solve problems that I knew a lot about or experienced on a day-to-day basis. And so that has been my life's mission since then. And we'll talk more about that now. Again, as you can see, my email at the bottom, feel free to send me a note or LinkedIn message anytime, and welcome any feedback or questions or support I may be able to provide to the group. So thanks for joining us here today. My career started, I studied engineering at the Naval Academy. So I studied systems engineering. At that time, I'd focused on robotics and digital communications. And so I had a basic understanding of engineering, and always was a problem solver and tinkerer, and liked building things. But when we graduated, as is customary for anyone that graduates from a service academy, you go into the military. And so my calling was to serve my country in that manner, and found myself commissioned as a Marine officer on the day of graduation, and was very excited to pursue this line of work. And so after I graduated, I went through training and became a infantry officer. And so I began my career as a platoon commander and an executive officer, which as a platoon commander, as a young man, I was in charge of about 40 Marines and sailors in a infantry battalion. And we conducted training and prepared for deployment to Iraq. So deployed to Iraq in 2008, we were conducting a lot of just basic stability operations, training the police there. Had a great experience. And when I came back, was then put in the position of an executive officer, which is kind of like a chief of staff for a company of Marines and sailors, of about 200 Marines and sailors. And so I wasn't in charge of as many Marines, but was working to support our company commander at that time, and had an opportunity again to deploy aboard ships and visit the Middle East and conduct non-combat operations during that time, and had a great time doing it. And so I found really the passion and purpose that I was hoping to accomplish in this line of work, primarily because of the fulfillment I got from being with high-performing teammates and being in leadership roles while conducting, complex and chaotic missions and solving problems at the end of the day. And so there's a wide variety of challenges we faced at different countries, different locations, and different avenues. And this was a really unique opportunity as such a young leader to have the autonomy to go forth and try to solve problems that were of supreme importance to our country. And so when I came back, I got very interested in staying in the military. And so I went through training to become a Marine Raider, which is a special operations Marine. And so I went through the training and graduated from the training in 2011. And at that time was a captain. And so I became a Marine Raider and was put in charge of a small team of special operations Marines and sailors. And so a Marine Raider is a new term because we're newer to the special operations community. But those of you guys who know about Navy SEALs, we're just like Navy SEALs, same level as them, just more handsome and funnier. And so that's how I explain Marine Raider to everybody. But nonetheless, we found ourselves preparing for a mission in Afghanistan where we'd be conducting what was called village stability operations, and deployed to Afghanistan in 2012. And so where we arrived was a very rural area, and village stability operations required us to live amongst the local populace there and work with them to try to help them establish security in the region and to develop governance and link all aspects of the economy, politics, and security together in that manner. And so had a great experience there. Unfortunately, where we were sent to the Helmand province, which was a pretty chaotic and uncertain environment. And because of that, found ourselves in combat with Taliban fighters on a frequent basis. And so these people in this picture, these are our policemen that we were working with, our teammates, and we trained them to be, a quite fine fighting force during our time there. The place we were sent was very primitive. So I like to show this picture just to explain a little bit about the mission that we were tasked to accomplish and some of the challenges associated with that. And so we were sent into this very fertile area of Afghanistan. Most of Afghanistan is desert. This area is farmland, what they call the Green Zone in the Helmand province. And the reason they call it that is because it's the most fertile farmland in the area. And at that time, all the people there were farmers. It was very primitive. As you can see from the building in this picture, the construction is very primitive. There's no doors or windows. There's no electricity. There's no running water. There's just mud, mud huts, mud walls, mud compounds. And although they were very primitive people, they'd been in this region for decades and millennia and centuries, and knew the area and their roles well, and knew the farming aspect of that well. Unfortunately, because we were there in 2012 and there had been recent conflict, obviously, all of the farming had turned to poppy. And so all of these farmers were now producing poppy in the region, which the Taliban were influencing them to do, and put them in a very unique position, a challenging position, where they were just trying to survive, and we're trying to help them do that. So these buildings, when we would conduct patrols, we would go out to these buildings in the cover of darkness, get into a building, and then stay in that building because the walls provided us cover from incoming enemy fire in many respects. And so that was the reason we'd go to these buildings. But the challenge was, if you're inside the walls, you're protected, but you don't know what's going on because you can't see. And so what we would have to do is we'd have to position Marines and sailors on the rooftop in order to be able to see what was going on outside of the walls of the compound that we were in. We did this, but knowing that once you're on the rooftop, you're now exposed to enemy fire. And so it was this kind of balance, this delicate balance we had with cover and concealment versus situational awareness and operational security. And so this particular building, we went to on a mission on June 14th of 2012. And you could see on the rooftop here, there's advantageous positions where you can see out into the area over the walls, but at the same time, you're quite exposed. And so what happened was we occupied this building shortly before sunrise. Everything was going well. One of my assistant patrol leaders and two other Marines were on the rooftop at that time, and they had gotten into an enemy engagement. about 15 minutes after that occurred, there was a lull in the fighting. And so I switched out with my assistant patrol leader to try to gain situational awareness by going on the rooftop. And shortly after I did, we'd been engaged by multiple fighters from different directions. And in the opening moments of that engagement, I had been wounded. So I'd been shot and by an enemy fighter. The bullet went into my left shoulder and lodged in my spinal cord, in my spinal column, resting next to my spinal cord. And so when that happened, I slumped over and instantly realized, that I tried to pick myself back up and realized nothing below my chest was working, and that I was completely paralyzed from the chest down. And so tried to triage myself, made a radio call to my teammates, and also saw that another Marine on the roof had been shot as well through the neck, and that he looked like he was either dead or unconscious. And so really couldn't do anything at that point except for wait and hope that my teammates would be able to help turn the tide of this battle and somehow get us out of there alive. And luckily they did. And so due to their heroism and bravery and willingness to sacrifice, we had a small team and were being engaged by multiple fighters from different directions, but they were simultaneously able to return fire to repel the enemy, triage and stabilize myself and Ricky, the other Marine who'd been shot through the neck, and call in air support and set the conditions for us to be safely evacuated out of off of the battlefield where we could move forward and recover. And so this was a very challenging and chaotic environment and something that we'd all trained for, but until it happened, had no idea how it would play out. And fortunately, Ricky, despite being shot through the neck, has made a full recovery and recovered from his wounds, and I, have recovered from my wounds as well as best I can, but I'm still paralyzed from the chest down. And so, for me, as a young leader, this is what I would call the best and worst day of my life. And so it was the worst day of my life because something I was so passionate about, something that I had dedicated my life to, in an instant, was taken from me. There was no ability for me ever to go back and be serving in a special operations capacity as a Marine leader. And so that was incredibly challenging and terrible for me, but it was also what I consider one of the best days of my life because I was fortunate to be associated with a team that performed at the highest level of special operations in one of the most complex and chaotic situations that may ever occur, right? And because of their training and their resiliency and their selflessness and their humility, I'm alive today. And so for me as a leader, that's an experience that I have that I don't know will be matched. And so I'm very proud to have been a part of such an amazing team and fortunate to have led them. And so this began my recovery process. Initially, I thought that I might recover a little bit or things like that. They basically said, hey, you're paralyzed, you may never walk again. They never said definitively one way or the other, which left me thinking a little bit positively, but at the same time was quite challenging to deal with once my progress stagnated as well. And so spent a while recovering and then tried to figure out what was next in my life and actually started applying to business school from a hospital bed because I wanted to have options. And so applied to UCLA before I had even, left the hospital and realized that was an option for me to move forward and try to pursue, learn new skills and pursue a new career. As I was going through business school, one of the things that I tried to do as an individual was to learn about medical technology and advanced clinical research for spinal cord injury. So I started to research everything that was possible and available on the market that would aid me or potentially help me to recover from my injuries. And so one of the things that I found was robotic exoskeleton technology. And this particular robotic exoskeleton was designed by a company called Rewalk Robotics. And it's a device that is now FDA cleared that enables people to stand and walk who've been paralyzed. And so I am still paralyzed from the chest down, but this is the only way that I can stand and walk. And so it's a pretty amazing system. And I'd set a goal to try to use this device for my retirement ceremony where I wouldn't need to use a wheelchair, and was able to accomplish that. And this moment for me was life-changing in many respects, because although it was just a piece of medical technology, a device, it had this profound impact on my life, because I realized that once I was shot and paralyzed, there was a chance that I would never walk again. And that would have been the case, except for the fact that there was an entrepreneur who had an idea and a vision, and developed technology to make that vision a reality, which was to help people who are paralyzed walk again. So armed with this knowledge and having had this experience, I'll try to show you this video as well, see if this pops up. Having had this experience, it made me want to pursue similar efforts, in that, I wanted to try to help develop medical technology that would improve people's quality of life for spinal injury. And so that was the experience I had. So I'll see if this loads. It might not play, but if not, I'll be able to share it with you guys later. But anyways, very simple device. Some complexities around it, but ultimately there's motors on the hips and knees that enable people to all right. So I'll show that. All right. So armed with this knowledge, I set out to accomplish my next mission, and had this idea while I was at school, which was the best way to secure funds and raise money for innovative new medical devices and medical technology to bring to market, and that I would be able to leverage my unique experience as someone with spinal injury, and as a new entrepreneur, to try to help advocate for these causes and develop technology to solve a lot of problems. And one of the most interesting things I learned, which I thought was awesome and still love about in the medical technology and medical innovation field, is that although your company is a for-profit company, the only way that you can be successful, truly successful in the industry, is if you have products and services that dramatically improve people's quality of life. And the more that you do that, the more profit your company makes. And so it's a virtuous cycle, I think, of technology development and commercialization through entrepreneurship. And so this was initially the idea for Spinal Singularity. I wanted to design multiple devices to improve quality of life for people with spinal injury. And so the first thing we set out to do was to address the issues associated with bladder management. So we developed what we call the IntelliFlow system, which is a bladder management system for adult males who've lost control of their bladder. And on our homepage, it should show this short animation here in a second. But basically, what the device does is it's a catheter that can stay in the body for up to 7 days, and then we have a miniature mechanical valve that's actuated by a wireless remote controller using magnetic coupling. And so the result of all of this technology is that you can now push a button to control emptying your bladder. And so you push a button to start the device, and then it's actively pumping urine out of the bladder. And then you can push a button to stop the device, and it will close the catheter and seal to enable you to let your bladder fill and move forward. So this is what we've been developing for the past 6 years. So it started with the napkin sketch. It's taken a long ways to get there, and a lot of support from investors and so many other people to get it to where it is today. And we're close to getting out on the market. So hopefully by the year end or early next year, this will be available once we've obtained FDA clearance for this device. One thing that's been interesting that I've found is instead of creating multiple products within the same company, because of the differences in the requirements for commercialization and touch points and different investment opportunities, instead of doing that, we've decided to create multiple companies, each with their own products, to give them the resources and time that they deserve. And so one of the most recent ones that has been a lot of fun, an amazing project that I've been fortunate to develop, is called the Habit Camera. And This device is a very simple design, an elegant design, and we leverage years of research from some amazing researchers at the VA in Minneapolis. But we've licensed the patents for this device and are working to bring it to market as a consumer product and a consumer electronics product very quickly. And so we licensed the patents about a year ago. We just did a soft launch of the website and are working to try to get it on the market in the next few months once we can get through our initial manufacturing with our contract manufacturers. And so this device is very simple, but solves a real need for a lot of people. And so it's designed for skin inspection. And so skin inspection can be valuable for anybody who is limited mobility, either using a wheelchair or bedbound, or someone who has diabetes or peripheral artery disease, who maybe developed foot ulcers, or even dermatology, someone who has skin cancer screening or moles or other issues to address. And what it does is, currently the standard is you receive a mirror. And so you're supposed to inspect your skin twice a day and look for, any sort of signs or symptoms of these skin issues using this mirror. And you have to kind of crane your back, and it's not ergonomic and you can't see anything. So the brilliant idea was to take a small camera and put it onto a phone or a tablet, put that image right in front of your face in real time. So it's easy to see, it's ergonomic and effective. And then by doing that, you also enable telehealth. So I can now save images and record video and then send them to clinicians, caregivers, or family members if necessary. So really excited about this, and it's coming along well. And then we have some other collaborations as well that have been pursuing, most recently. So this one is called IntuBlade. This is a intubation system for complex airway management. And so I did not invent this, but met some other veterans who did, and have been working to help.
Derek, we lost you. Okay, I think we lost Derek.
Oh man, the Zoom gods.
Okay, back. Thank you.
They got me. I could close my slides anyway. I was done, right on time and just in time for questions. So, anyways, that's been the journey I've been on. It's been amazing, and it's also been amazing to have organizations like IEEE and other groups and other gatherings of people to collaborate with and to commiserate with and support, receive support from. So thank you for the opportunity to chat with you, and happy to answer any questions you guys have now or at any point in time, like I said, with my email address. So
we have one, but I can answer this one. Yes, you will have a video recording. It will be posted on the IEEE website, and I will show it on the LinkedIn as well. We link to that recording. So let's keep going.
Sounds good. Good question.
Any other questions, anyone?
Yeah, I have a question, Derek. Yeah, absolutely amazing and inspiring story. I had no idea about your background. I thought this was like a purely technical, talk on just some medical devices. Unbelievable. I cannot imagine the psychological, emotional side of what you talked about. I mean, the ups and downs of it. I don't think I can relate to that at all until you go through something like that. I have one question. So seems like you're involved with, let's say, several companies, startups, products, ideas, whatever. So are you able to sit in a car and drive and go around and be normal in terms of the physical side of being everywhere all the time? Or?
Yeah, I can get around pretty good. I've traveled, I've logged some miles. So, that's one of the interesting things with being in a wheelchair is mobility is not too bad in most places. So like I have been to Europe, I've been to the Middle East, I've been to Africa, I've been to China, I've been on the Great Wall of China, all in a wheelchair, right? Like I've been able to get around pretty well. And up until recently was traveling frequently for work and doing different things. But most of the companies that I work with now, they're all very early stage. So the kind of the place where I've tried to focus all of my time and attention is in early stage, like founding stage, pre-seed, seed stage companies. And what I found is the reality is it's incredibly hard just for any one of them to be successful. So in some respects, having a portfolio of companies that you can work with can be helpful, especially because they take so long, right? It takes so long. Like Eurodev Medical has been in business for almost 6 years, right? And we're still not on the market. And so, so now over the past few years, as I've kind of learned a little bit of the recipe for success, I've explored other opportunities and have, started to resource some of these different projects. But great question, Jay.
Yeah, so you're able to put your mind to it and then do it as if same as being like any other person. It's a matter of where you want to go, what you want to do, kind of thing, right? Basically.
Yeah, definitely. Yeah, and I find myself very fortunate. So one of the things which psychologically is really important to me and like has helped me to move forward beyond a lot of challenges is gratitude, right? And there's two ways to look at any situation. You can either feel sorry, for yourself or what you don't have, or you can feel grateful for what you do have, right? And fortunately for me, unfortunately, I know a lot of people that didn't make it back from Afghanistan and that were killed, right? And so over a long time, as I was kind of coming to terms with this, I started to realize, and one of the things I try to do every day is to be thankful just to be alive, right? Like, because it could have very easily been worse, right? I could have been, been killed in that. I may not have survived that instance, and you can always think about what you don't have, but at the same time, it almost is impossible for me not to be grateful, because I think about those men, Matt, Ryan, and Sky, a few of my friends who didn't make it back from Afghanistan, and I realized that any one of them would be happy to be in my situation, right? And would be happy to be alive, but in a wheelchair. And so, so that's one of the things one of the things I think about on a daily basis, Jay.
Yeah. So my real question is this on your talk. So I've been trying to follow medical devices, and my background is happens to be electronic hardware design. So do you feel over the next 9 to 10 years, meaning this decade, in medical devices, is more innovation happening and will happen because of hardware miniaturization, or is it software and AI and getting smart about how the body behaves under different conditions, so that you don't do too many alerts, too many panic thing, too many misunderstanding about, okay, everything is in ranges, it seems to me, whatever you measure medically, biologically, unlike networking and other stuff where the traffic is very precise and so on, right? But this is
Yeah, I think so if I distill the question into hardware or software and the impact, it's impossible for me to know, but I'm bullish on hardware. I'm not an expert I'm just learning a lot about, I'm starting to learn a lot about, AI and machine learning and those sorts of things and the impact that they'll have. And that could have a, completely outsized or massive impact on the industry. But at the same time, I don't see hardware, the need for hardware going anywhere soon. A lot of the things that we do and what I try to focus my time on is all hardware solutions. There's software involved, but at the end of the day, advanced, there's still a lot of innovation available in the hardware space. I mean, our device, our catheter, you would have thought somebody had designed this already right now, right? It's a simple mechanical solution in the body, and there's the electronic solution outside the body, but no one has solved it, right? And so, like, why in 2015 was I the first one to try to figure this out, right?
No, as an example, on your habit camera, is the image and the hardware and the speed and the resolution important, or is the automated comparison, let's say, of pictures taken every 5 minutes, every 1 hour, every 1 day, whatever, and then AI or image processing?
Yeah, it depends. It depends on the market, right? Product market fit. And so for us, we don't use any AI or machine learning for that product. We don't store any patient data. We don't store any images. There's no cloud connectivity built into the first version because we're selling it as a consumer product, and that would all necessitate regulatory compliance. So a lot of it's like you have to massage the product market fit with the clinical impact, right? And so I'm not trying to implement the habit camera to solve or to replace a clinician. We developed the habit camera to make it easy for people to look at their skin, and so that's just a bit of a different solution on that. And so yeah, so I don't know the answer to your question, but that's kind of where I've positioned some of the things, and so I hope that answers it.
A couple of questions. One is, Derek, can you tell us the surgery and location of the Eurodev device and how the device is powered?
Yes. Yeah, so the EuroDev device, we designed it. So one of the important design inputs that could be inserted or removed by the user themselves. And so we actually help to train patients how to insert and remove the device themselves. It's non-surgical, it's minimally invasive. It's similar to inserting other catheters, which they're already doing. And so that was how we had designed that device. And then what was the second half of that question?
How was device powered?
Oh, device is powered. So we have a wireless remote controller that has a lithium-ion battery that's rechargeable in it. That's the device that's outside of the body. It's a very fancy way to spin a magnet. And so the basic technology is when you spin one magnet in close proximity to another one, the other one will spin sympathetically. And so really all the controller does is spin the magnet one way and then spin it the other way. And when we get that in close proximity to the catheter, then the magnet that's inside of the catheter will spin sympathetically. And so there's no electronics, there's no power source, there's nothing inside of the catheter currently the way we've designed it. And that's due to complexity and regulatory challenges and everything else. But that was how we kind of addressed that issue.
Thank you. Next question. Does the equipment that helps you to walk require a battery? If so, how many man hours can it provide? So how long does it run?
Good question. So I think right now the batteries do 8 to 12 hours. So it's a lot. It'll power someone for a long period of time. Because most people can't walk for 8 to 12 hours straight. If you're paralyzed, it's physically taxing and everything else. So it's a very healthy battery life.
Thank you. Next one. When do you think the Euro device for controlling bladder will be available on the market?
The goal is like maybe late this year or early next year. So probably realistically, if there's any delays, it'll be Q1 of next year.
Next question. Hi, Derek. I was curious, whatever you believe your studies at UCLA in business management was useful, and what do you feel was the most helpful from it?
Yes, yeah, it was absolutely helpful. For me, it was great for a few reasons. So I had never taken a business class before, so I didn't know anything about accounting or finance or marketing. I had no knowledge whatsoever of those types of disciplines. And so I actually learned a lot from the classes that were there. I learned a ton. I tried to take as many classes as I could. So academically, I was learning. And then as important as well, I was able to build a network of amazing people like Olga and others that, helped me to learn, and I was able to learn from them as well. And so it was absolutely important and valuable for me. But I get that question from a lot of people who want to start companies and entrepreneurs, and you definitely don't have to go to business school to start a company, right? You could easily just start your own business. You can do it. But for me, it did help, and it was a good transition period. And so I'm very glad I went, because I had zero knowledge, and I would have been even less prepared if I had just started a company on my own.
Thank you. Next one from Harjat Singh. Good to see you, Derek. Out of curiosity, of all your experiences, which experience would you say most prepared you to successfully launch, run, and grow these companies, develop these novel devices? Launch, learn, grow the companies.
Yeah. So I think initially a lot of it, like the starting point for me is problem solving. Like being a critical thinker and a problem solver is what we train to do as special operators above all else. And in doing so, I had this inherent curiosity and desire to solve problems. And so that's kind of the foundation, I think, for new product development and everything else. And I think is very important at the earliest stages. And then beyond that, business school was great. Having time in the military as a leader and really above and beyond just being a leader, learning to communicate effectively and succinctly was foundational as well. And then after that, it was just personal need and knowledge of the problem, right? And that was the hypothesis of spinal singularity from the beginning, was who knows these problems better than me, right? Some people might, but I know them pretty well because I live with it on a day-to-day basis, and it's one of the benefits of starting a company to design products for yourself.
Thank you. The amazing success, many early companies struggle to raise funding for just one technology. What are the tips you learned, and what key factors did you leverage to gain funding and sustain momentum? How much of the fact was in it that you were able to open conversations as an engine veteran? Or do you think your absolute understanding of the customer was the most important factor? Most medical technologies are developed by somewhat independently of customer needs.
Yeah, I think the most important thing and what I'm learning now is the story, right? Like the pitch, the story, the business, like the product market fit has to be tight, like very tight. And unfortunately, a lot of investors, well, whether it's fortunate or unfortunate, a lot of investors will assume technologically that you'll figure it out, right? Given enough time and money, you could figure out most of the technical risk. Same thing with, market risk as well. That's one of the ones that hone in on more. And so, so as far as fundraising, a lot of it was really the business case for what we were going to do. Because when we started, we had nothing. We had a napkin sketch, right? So we had no technology. We had no patents. We had a lot of passion. And what I said was, this is the market opportunity. This is what I can accomplish if we have this device that meets these specifications. I need some money to build it. And it took a long time, and we, had to sell our souls a little bit, and like do whatever we could to get the company funded. Everything from crowdfunding to grants to investors to incubators and accelerators, everything. We did everything. But we made progress and we got to the point where we are now. And ultimately, because of that, I think because we spent a lot of time understanding that product market fit up front, we haven't strayed from that significantly. In fact, it's been refined a little bit, but there's not a ton that has changed from our business plan since day one. The commercialization scenario is still the same. The majority of everything is pretty much the same. And we've just found technology and integrated technology to accomplish that. So that was my experience from Eurodev Medical. But one of the interesting things, the other thing that's interesting, like for Habit Camera, we haven't raised any investment, right? We've raised $0, and it's just something that I've put, my own personal funding into to try to develop. And it was an interesting project because I think we can get it to market without funding. And so we're already open for pre-orders online and are taking orders now. And we're already in the almost to manufacturing. We're going to be doing our first manufacturing run in a few months once we kind of review, finalize our design and review it and lock it in and go to a design freeze. So that's a bit of a different situation. But raising funds is hard. There's no secrets. But if you don't have a good story to tell about a big market and a clear path to market and all those essential elements of it, it's definitely not going to happen.
I want to jump a little bit ahead and ask a question from Lee. Do you have a website where we can see more details regarding how the Eurodev device is placed in the body and the mechanism driving the flow to empty bladder?
Yes. Yeah. So if you go to our website, we have some of those videos. We have a bunch of videos online. We're actually in the process of updating one. We should have a new one out in like a week or two as well.
You have a link to the website? What's the website name?
Yep. It's eurodevmedical.com.
Okay. Thank you.
Yep.
The next question is, can you please describe more about why you chose to go with different medical companies instead of one company designing several products? So why for each product a separate company?
Yeah. So one is focus. One is resources. Another reason is commercialization scenarios. So with the urology product, for example, Habit Camera, right? If I could have folded Habit Camera into Eurodev Medical, would it have worked? Maybe, but Eurodev Medical is going to build a sales force that's going to be targeting urology clinics. So that's a totally different point of sale than the Habit Camera, which is a rehab facility or a wound care clinic or a dermatologist office or a podiatrist office. And so once you think about the commercialization strategies and the focus of those efforts, inherently, if you try to do both, you're going to be fighting for resources. So companies that develop multiple products that are successful typically have the same call points, whether it's acute care in hospitals, ICUs, urology clinics, any of those sorts of things. And then beyond that, to date, we've raised over $8 million from investors to develop this product for urology, and it's still not on the market. And so I don't have a position to say, oh, hey, I'm going to divert some of this money to another product, right? Like investors would kill me if I did that, right? Because they put their money into this and they want a return for this. And then frankly, on the same token, I don't want them to share in the profits from that product. When Habit Camera is successful and we're making money, those investors didn't invest in it, so they shouldn't make money and profit from that. And so initially where my hypothesis was we could build a company around spinal cord injury and spinal recovery. I quickly found that wasn't the case and that we needed to focus. And so for me personally, to try to accomplish the same mission, I remained focused for the first 5 years of the company, and then only recently have begun to help advise other startups and to found other startups to build other products that are also in the similar space but non-competitive. So that was the method or the reasoning behind multiple companies instead of one company.
What has been your experience in getting devices cleared by FDA?
I have no experience, so yeah. So we've been engaging with FDA. I have no FDA cleared products yet. My experience thus far has been in the pre-submission meetings. We filed breakthrough device designation requests, which have been mixed, have had mixed results. Some successful, some not successful. The FDA is a big bureaucracy, just like many other government bureaucracies, and so they're interesting. But so far, we haven't had anything major to complain about. We've had some minor issues here and there, and a lot of learning. But it's hard. But if you have a good strategy and good consultants, which we do, we're fortunate we have a great consulting company that we use up in the Bay Area that supports us. And so it's a process. And so the one thing I will say is I've learned is like many bureaucracies, if they give you a process, it's usually good to follow the process.
Right.
Like where a lot of people complain and they get hurt feelings is when they're trying to do something that doesn't follow the process. And they're like, well, why don't you just do it? It's outside the process. You should know to do that. And you're like, yeah, okay, you can try to get them to do it, but you got to take ownership of the fact too that you're not following the process, right? So you should be smarter to actually figure out how to fit in the process, and then you won't have that headache. So a lot of that I think is self-induced with the way people handle bureaucracy.
That's a good advice, by the way. Where do you credit the pragmatic ingenuity to come up with low-tech solutions for end users in a tech-crazed market? Where do you credit the pragmatic ingenuity to come up with low-tech solutions? A lot
of it's not mine. Yeah. A lot of it's not mine. It's not my ingenuity. So I think like when we're thinking about the IntelliFlow and Eurodev Medical, we were problem focused. We were focused on solving a problem, right? And then technology agnostic. And so when we started, we looked at everything, right? Surgery, non-surgical, short-term, long-term, like all of the different aspects of features, and then went through the customer discovery process to refine that with actual users, and found the optimal combination of high-tech, low-tech, existing technologies, rapid time to market, all of those sorts of things that met with our business model and our acquisition plan. All of the other technologies that I mentioned, I am not the inventor of, but I've become attracted to mainly because of it fits that profile, right? Where it's not rocket science, right? It's lower tech or proven tech, things that may have already been developed in academia and already have existing patents or other intellectual property that's novel and innovative. And so that's how I've been trying to address that issue. And so I definitely don't deserve the credit. A lot of people, and some of the people on this call, I think are also collaborators as well that have developed these technologies. So I deserve the credit. There's a lot of people that are solving it that way. And I would challenge you all to think about that as well. As there's a spectrum. If you have to solve a problem, you'll have simple solutions that could solve the problem. But sometimes people will, create over-engineered and overly technical and overly advanced solutions just because you're excited that you can do it and you can build all that, right? And it's like, you want to take a step back and look and say, okay, if I can accomplish it with a simple solution, maybe that's better for business than just building in additional features without, any sort of return. Nice.
I will add to this one next question. What about if we want to invest, and are you using crowdfunding?
Crowdfunding, yeah, investment. So I have not used crowdfunding for investments. I've heard it's great. I've seen a lot of people that have done it. That's great. We've done like non-investment crowdfunding. So we did like Indiegogo and some of those other things with Eurodev Medical when we first got started, and did some other things. But all of our investment has just been from like typical equity investments.
And if someone wants to invest,
Yeah, just follow up with me. Send me an email or a message and whatever. Send me a message and we'll follow up and
Next
see.
question, I like it. Derek, thank you for your stories. I would like to be the distributor for South Korea for your product, specifically Eurodev products.
Sounds awesome. Yeah, send me a message. Would love to shop.
If you you can send an email, or I can share Derek's email too.
Yeah, you can put my email in there. It's just Derek at derekherrera.com. So DEREK at DEREKHERRERA.com. I'll put it in the chat profile right now.
Can you put it out? Next question is, what would you advise for someone who has ideas for medical devices, but isn't sure what the next steps would be?
Yeah, so if you have good ideas, the best place to start is to try to find product market fit, right? Before you invest a dime to develop anything, if you have the idea, start writing it down, start writing down your hypotheses, figure out who's going to pay for it, right? All of that sort of stuff. And that's what I would suggest, you start with, because before you invest the time to develop something technically, which could be a lot of time and money and effort, build the business first, because the business, you can test that case for free, right? And you should refine that, and that should inform your product development or your product design.
Yeah. Are you able to move from wheelchair to a regular chair or a bed by yourself? If not, is there a piece of equipment that helps you with that movement?
Yes, yeah, I am. I'm able to transfer. That's called a transfer, to transfer from a wheelchair to a chair or other means. So because I have upper body function still, I'm able to do that. But there are, and when I was first in the hospital, they do have things called lifts. There's one that's called a Hoyer lift, and that one is like kind of the standard, but it's like this thing that you strap into, and then it's like a mini crane that'll like pick you up and drop you or move you around or wherever you want to go. So they do have those devices, but I'm fortunate not to have to use one right now.
Thank you. Derek, what a great story. What has been your biggest frustration in the medtech industry? Are you finding FDA clearance to be a big showstopper? Are you finding FDA clearance to be a big showstopper?
I don't think it's going to be a huge showstopper, but it's going to be a really important milestone for us. But even once we get FDA clearance, it's not, it's not like we're just cashing out and disappearing. We actually have to commercialize this product to build value for the company. And so we're building a real business, and we're going to be selling real products for people that, that's hopefully going to change their lives in a very impactful way. And so FDA clearance is an important milestone, but it's not the end of the journey whatsoever. And so for the medical device and medtech industry, one of the biggest issues and the most challenging things to navigate is the lack of access to capital for early stage development. Mm-hmm. And so there's this kind of challenging point. Initially, most initial funding is from grants, from SBIR grants and research grants. And because of that, investors don't want to take they don't want to take on early risk because the returns just aren't there when compared to software and other, extreme high tech, apps and all the Facebooks and everything else. It's hard to compete with that. And because of that, there's like a handful of people in the US and even the world really that will do seed stage or Series A stage investing for early stage medical devices and medical technology, specifically medical devices. And so that's one of the biggest frustrations with it, but it also creates opportunity, right? So if you are able to get it through that and get to that point, what happens is there's a massive influx of people on the back end that will do a Series B, right? Mm-hmm. So there's tons of capital once you make it past that, and we've kind of made it past that now with Eurodev Medical, and we're going to go raise a Series B later this year. We have hundreds of people in the US that are all sitting on capital waiting to deploy it, and so it's kind of frustrating. It's very hard and very, very frustrating the beginning stages because no one's fronting capital for development. But if you survive and figure out how to get there, your chances of success are way higher. Mm-hmm. Yeah, and the access to capital is it's big. So
okay, Derek, can you share your website one more time, or can you show it on the screen?
Yes, yeah, I'll put the link in here too. It's eurodevmedical.com.
Mm-hmm. Thank you.
Oh, let me make sure I send that to everybody.
Any other questions, anyone? So we're reaching out to the end of the hour, and I want to thank Derek for amazing presentation and quite an inspirational story. Derek, do you want to do the call to engineers if you guys are looking for people who you want to hire? Because your community right now is all engineers, and this is across different societies. It's like Lee is running the Biomed Engineering Society, so you can make a call right now. If you are you're looking for a talent.
Yeah, I'm always looking for talent and networking. Unfortunately, we're not hiring anybody right now full time or anything like that. But yeah, I'm always open to networking and talent. So we'll be happy to follow up.
Thank you. And on that note, I'd like to thank everyone for attending session.
You close out, I just like to, I think everyone in this webinar would like to sincerely give our thanks to your service. Very inspirational with taking the situation and create so many solutions to help others going forward. And you already met some of the people who are willing to help. So feel free to leverage this network through the IEEE network. Thank you very much.
Thank you. Awesome. Thank you so much.
Thank you very much for today and your time.
All right.
Bye, guys.
Bye.